Okay, today we will discuss the MCQ of microbiology. Okay. Hmm. The first question: Gram stain is a simple stain, differential stain, negative stain, none of the above. So it is a differential stain. These are positive stain which divide bacterial population into two different groups by imparting two different colors. So gram stain is the most common staining methods of in bacteriology. As we know, it stains cell walls of the bacteria. So which portion stains cell walls of bacteria? Gram positives appears blue. That means blue color means gram positive bacteria. Gram positive bacteria. And pinkish or red, pink or red colored means gram negative bacteria. So this is how we identify gram positive bacteria, gram negative bacteria by using gram stain. And Jedensen stain is used to distinguish acid first bacteria and non acid first from non-acid first bacteria. Presence of mycolic acid is responsible for acid first nature of bacteria. So acid first nature of bacteria is imparted, or acid first nature characteristic is imparted to the bacteria by the presence of mycolic acid. So all these questions, all these extra questions are also here in this explanation. These questions are also common in FMG. Okay, going to next question. Method of choice for sterilization of liquid paraffin: flaming, moist heat, autoclave, hot air oven. Method of choice for sterilization of liquid paraffin. And the answer is hot air oven. So hot air oven is called dry heat sterilizer. Dry heat sterilizer. The articles should be sterilized at the temperature of 150 degrees Celsius to 170 degrees Celsius for 1 hour. So this specification is very important. Very important. 150 degrees Celsius to 170 degrees Celsius for 1 hour. This can also come in the question. So this specification is very important. Next is flaming. Flaming in this method, what happens? The article should be sterilized on the hot flame of the Bunsen burner. Okay. In hot air oven, what are the things that can be sterilized by this method of hot air oven? Glasswares like test tubes, pipette, flask, glass syringes, fixed oil glycerin, liquid paraffin, propylene glycol, and zinc oxide. All this can be sterilized by this method. Another popular method is their autoclave machine. Autoclave. In this type of sterilization, it is done by steam heat under pressure. So it is done by using steam. It is done by using steam. Very important. And the steam and the heat from the steam auto sterilize the materials. And the materials that can be sterilized by this methods are glasswares, surgical dressing, rubber gloves, surgical instruments are sterilized by this method. So all these materials that can be used in each of these method must be remembered. So method of choice for sterilization of liquid paraffin. Liquid paraffin is can only be sterilized by hot air oven. By hot air oven. That's why we choose number D. Okay. Next question. Hot air oven efficiency is best checked by which bacteria? Thermophilus, Bacillus subtilis, Clostridium tetani, Streptococcus. Hot air oven efficiency. Efficiency of the hot air oven can be verified by which type of bacteria? That is Bacillus subtilis. So hot air oven is dry heat, as we have studied just now, dry heat sterilization technique, which is used most commonly to sterilize glassware and metal items. Glasswares and metal items. Sterility check is done for each and every lot to enhance the quality of sterilization. For this purpose, the biological indicator organism is Bacillus subtilis, which is used as biological indicator. How much it gives the efficiency of the sterility or quality of the sterilization of hot air oven. So non-pathogenic Clostridium tetani can also be used to check the efficiency, and Bacillus subtilis is much more better than Clostridium, non-pathogenic Clostridium tetani. This can also be used non-pathogenic type. Non-pathogenic type of Clostridium tetani can also be used, but more better than C. tetani is Bacillus subtilis. And Stearothermophilus is used for checking the efficiency of autoclave. And this is for hot air oven. This must be remembered. Okay. So next question. Which of the following culture medium is made by adding agar? Solid medium, liquid medium, selective medium, transport medium. Which of the following culture medium is made by adding agar? Solid medium. So growing bacterial cultures in liquid nutrient broth. Nutrient broth is liquid bacterial growth medium made up of powdered beef extract and short chains of amino acid that had been dissolved in water. And liquid medium is convenient to use for growing bacteria in test tubes and can reveal information about the oxygen requirements of the bacteria growing within. Bacteria that require oxygen will grow close to the water surface. Because as we go towards water surface, they can get more oxygen, or they can get oxygen more easily. And bacteria that cannot tolerate the presence of oxygen will grow at the bottom of the test tube. Now, on solid media, what happened? Broth media can be made solid by adding agar, which was our question. Broth media can be made solid by adding agar. And nutrient broth is liquid bacterial growth medium made by, so basically this broth is made by powdered beef extract and short chains of amino acids that has been dissolved in water. So nutrient broth, always remember, very important point. Nutrient broth is a liquid bacterial growth medium, first of all, made up of beef extract plus short chains of amino acids dissolved in water. Liquid medium is convenient to use for growing bacteria in test tubes, and can reveal information about the oxygen requirement of the bacteria. So liquid medium can be used for identifying aerobic and anaerobic bacteria. Those who are aerobic will grow near to the water surface. Those who are anaerobic, they will grow at the bottom of the water surface, that is at the bottom of the test tube. And broth media can be made solid by adding agar. And what is agar? It's a gel-like polysaccharide that is extracted from red algae. This is each one of the line is a question. Like agar is basically, it's a gel-like polysaccharide extracted from red algae. So agar comes from red algae. And broth plus agar, it becomes solid. Broth with about 1.5 agar added, 1.5% agar added, will be liquid when heated, but at room temperature it is solid. So at room temperature it is solid. and making it easy to pour into a vessel, such as petri dish or test tubes when hot. And then solution becomes solid once cooled at room temperature. When heated, it is liquid, but when it gets cooled, it becomes solid at room temperature. When it comes at room temperature, it becomes solid. So 1%, how much agar is added? 1.5% agar is added. Okay, next question. Culture media for C. diphtheria, New York media, cysteine tellurite agar, Thayer-Martin agar, tellurite agar. All these culture medias are very important. Culture medias are all very important for microbiology, for FMG from microbiology. Okay, so culture media for C. diphtheria is tellurite agar. Now, two medium are important for C. diphtheria. One is tellurite, another is Leofer serum slope. Tellurite is used for diagnosis and it is the best medium for diagnosis, but the problem is it takes days for identification. It takes days. While Loefflers is also very good, and it can be used for, it can be we can identify C. diphtheria in Loefflers medium within hours. That is why for earliest diagnosis we can use Loeffler serum slope. But for best diagnosis, if we have time, then we will go for tellurite. Okay, so these two media are important for C. diphtheria. Okay, next question. Which of the following is best for the diagnosis of genital TB? PCR, Mantox, LG medium, ZN staining. And the answer is LG medium. Answer is LG medium. So Harrison's, as per Harrison, in genitourinary TB, culture of three morning urinary specimen yields a definitive diagnosis in 90% cases. LJ medium is the most common solid medium used for this culture. So genitourinary TB, for genitourinary TB, what we do? Culture, if we need to do culture of urine specimen, then three morning samples should be taken, and it will yield the definitive diagnosis in 90% cases. And LG medium is most common solid medium used for this purpose. Okay, so LG medium is the best for diagnosis of genital TB. So the prevalence of genitourinary TB is 10 to 15%. Most commonly caused by urinary frequency, dysuria. All these are symptoms. All these are clinical features. So clinical features like, most common clinical features are urinary frequency, dysuria, nocturia, hematuria, flank or abdominal pain. Diagnosis, just now we discussed culture of three morning urine specimen, and is the definitive diagnosis. It is the definitive diagnosis in nearly 90% of the patient. Other tests includes IV pyelography, abdominal CT, MRI. MRI may show some deformities or obstructions, and if it becomes moderate to severe or more, then there will be calcification, and ureteral strictures can also be seen in moderate genital TB. Before being severe only, we can see ureteral strictures, and calcification occurs almost at the severe stage of genitourinary TB. Complication can include in female, it affects the fallopian tubes and the endometrium and may cause infertility, pelvic pain, and menstrual abnormalities. So this is about genital TB, and must be remember this test. 3 morning urinary specimen yielding definitive diagnosis for genitourinary TB. And the medium is LJ medium. LJ medium. Now, diagnosis requires biopsy or culture of specimen obtained by dilation and curettage. In male, it affects epididymis, producing a slightly tender mass that may drain externally through a fistulous tract. There may be orchitis, and prostatitis may also develop. So it affects epididymis, producing slight tender mass that may drain externally through a fistulous tract. And there may be orchitis or prostatitis also. Treatment can include chemotherapy, means anti-TB drug. Okay, anti-TB drug. So this is about genitourinary TB, and must be remembered for genital TB, we have to use which medium? LJ medium. LJ medium, and definitive diagnosis is 3 morning urinary sample. Okay, next question. In Robertson cooked meat media, meat color will change into pink, red, blue, no color change. Robertson cooked meat media. So the answer is pink. Color change in Robertson cooked meat media depends on clostridial organism. Clostridium perfringens, C. perfringens, color turns to pink. And in tetani, C. tetani, color turns to black. So this color change will should be remembered. So for C. perfringens, it is pink. For tetani, it is black. But pink is the most common change. Robertson cooked meat media is most widely used fluid medium for anaerobic bacterial culture. Very important. Most widely used fluid medium. Most widely used fluid medium for anaerobic culture, anaerobic bacterial culture. McConkey medium is an example of selective media, differential media, enriched media, transport media. Is an example of which type of media? The differential media. McConkey medium. So differential media can also be called as indicator media because it differentiates from one group of bacteria from another group. For example, McConkey differentiates gram-negative bacteria from lactose fermentation bacteria. Those bacteria which carry out lactose fermentation. So differential media distinguishes one organism type from another growing on the same media. This type of media is used for detection of microorganisms and by molecular biologists to detect recombinant strains of bacteria. So all these are differential media. Names of some of the names are blood agar media, EMB or eucine methylene blue, McConkey, mannitol salt agar. Now McConkey is a culture medium designed to grow gram-negative bacteria and differentiate them from lactose fermentation. First of all, gram-negative bacteria can be grown in McConkey. And first of all, growth can occur. Gram-negative bacterial growth can occur on McConkey. Number two, differentiation can also occur. Or in McConkey only, we can differentiate these gram-negative bacteria from those of lactose fermenters. So McConkey, it consists of peptone, lactose, agar neutral red and taurocolate, and shows up lactose fermentations as pink colonies. So gram-negative will come as red colonies, while lactose fermenters will come as pink colonies. And those non-lactose fermenters will be colorless. Okay, next question. Well-Felix reaction is what type of agglutination? Slide agglutination, tube agglutinations, passive agglutination, direct agglutination. Well-Felix reaction is what type of agglutination reaction? And the answer is tube agglutination. So there are many types of agglutination reactions, and we will see each one of these and their usage. First of all, direct agglutination test. Number 2, slide agglutination test. Number 3, tube agglutination test. Number 4, passive agglutination test. So direct agglutination test determines the blood group. Bacterial agglutination test for serotyping and serogrouping. So direct agglutination test is used for determination of blood group, and bacterial agglutination test for serotyping and serogrouping. So this direct agglutination test, all these are direct agglutination test for blood grouping, for serotyping, serogrouping. For example, Vibrio cholerae, Salmonella species. All these can be grouped by direct agglutination test. Next is slide agglutination test, used for serotyping of Salmonella only. Used for serotyping of Salmonella. Another is VDRL test, can be done by slide agglutination test. VDRL for done for syphilis. Okay, next is tube agglutination test, also known as standard agglutination test. Used for serological diagnosis of typhoid. Serological diagnosis of typhoid. Serological diagnosis of typhoid. Brucellosis, typhus fever. Most important, typhoid. And also remember typhus fever and brucellosis. Example, Widal test is a tube agglutination test. Widal test, Well-Felix reaction, Khan test. All these are tube agglutination test. Very important. They can simply ask like, this question is Well-Felix reaction is a what type of agglutination? Very easy to ask. Is Widal test is what type of agglutination? Must be remembered. Widal test is tube agglutination. VDRL also very common. VDRL for syphilis. VDRL is what type of agglutination reaction or test? Slide agglutination test. Okay, next passive. It is used for Rh factor, ANA antibodies, anti-nucleic antibodies, which is positive, which comes positive in SLE, systemic lupus erythematosus. Antibody to Trichinella spiralis and antibody to group A streptococcus. Also, it's a type of passive agglutination test is employed for this. So all these agglutination tests must be remembered with their usage. Okay. Next question. In prokaryotes, which of the following is present? Nucleolus, endoplasmic reticulum, Golgi bodies, muramic acid. And the answer is muramic acid. Muramic acid. So all of the above options except muramic acid are membrane bound organelles. Obviously, these membrane bound organelles will be absent in prokaryotes, right? Will be absent in prokaryotes and only present in eukaryotes. Now, muramic acid is one of the important components of peptidoglycan wall present in the cell wall of prokaryotic cell. So to remember that muramic acid, one of the very important component of prokaryotic cell. It is present in the peptidoglycan wall of the cell wall. And all other, this nucleolus, endoplasmic reticulum, Golgi, all these are membrane bound organelle and they are present in eukaryotes. Very simple question actually. Okay, next question. Lancefield classification is done on the basis of C substance, glycoprotein O, muramic acid, antibiotic resistance. Lancefield classification is done on the basis of. Lancefield classification, what is it? It is a grouping system for beta hemolytic bacteria. For grouping system for beta hemolytic bacteria. Based on polysaccharide in their cell walls, C substance like carbohydrate, which is antigenic. So classification is serologic. And this classification, this grouping is a serologic type. All of the following methods are used for the diagnosis of HIV infection in a 2-month-old child. So all of the following methods, these methods are used for diagnosis of HIV infection in 2-month-old child, except which one of this is not used for diagnosis of HIV in 2-month-old child? And the answer is ELISA. Very important question. ELISA. ELISA HIV measures antibody. In ELISA, what happens? It measures HIV antibodies against the virus. These antibodies are of IgG type, right? These antibodies are IgG type and can cross placenta. Very important. That's why this shows what vertical transmission can be done, can occur. Vertical transmission. That's why vertical transmission occurs from mother to child. So these antibodies are of IgG type. Very important, this type also remember, HIV antibodies are IgG type. Hence, a baby born to HIV positive lady will test HIV positive on the day 0 of life. On the day 0th of on the 0th day of the life, and it may continue till these antibodies are cleared by the baby's immune system. The clearance may take 12 to 18 months and therefore babies born to HIV lady may be false positive till the age mentioned. So what is happening? As this IgG, because the mother has anti-HIV antibodies, anti-HIV antibodies, that is IgG type. When child born, this IgG will come, and as IgG will come, what will happen? This baby will test positive for HIV positive. It shows HIV positive, but do remember that antigens are not present, only the antibodies are present. Only our antibodies are present. Okay, there is a chance of vertical transmission in HIV, but sometimes what happens? Only IgG comes, only antibody comes on the day 0. That's why on day 0 it will show HIV positive. But after 12 to 18 months, what will happen? This IgG will be removed. However, DNA PCR or viral culture or P24 antigen, DNA PCR, viral culture, P24 antigen positive on first few days of life is indicative of perinatal transmission rate of virus, which is 30%. So if now the complex things comes, if first a baby is born to HIV mother and ELISA is positive, ELISA can be positive very easily because ELISA measures IgG. Now, when a baby is born to a HIV mother, two things can occur. Baby can born with only IgG, and baby can also born with active infection also, plus IgG, may be IgG or may not be IgG, plus minus IgG. These two situations can occur. Now, if this first situation occurs, that means then ELISA will show positive, HIV positive, but the baby is not HIV positive. Only IgG is present, and after 12 to 18 months, IgG will be removed, and baby will be showing, ELISA will be showing it's HIV negative. So, baby born to HIV mothers has to can also be checked with DNA PCR, viral cultures, and P24 antigen assay. Now you can understand by the name only, DNA PCR, viral culture, P24 antigen will check for the antigen, will check for the infection. So if the first situation occurs, if there is no infection, then DNA PCR, viral culture, and HIV, and then DNA PCR, viral culture, and P24 antigen assay will show negative, but ELISA will show positive. Okay, because ELISA measures HIV by the presence of antibody, and the baby has the antibody because due to transmission from his mother, from his or her mother. But if there is infection, if ELISA done on the baby, it shows positive, HIV positive, and also DNA PCR, viral culture, and P24 antigen shows positive, then obviously the baby is infected. Vertical transmission has occurred. 30% cases, in 30% cases, vertical transmission occurs. Vertical transmission of the infection, not the antibody. Vertical transmission of the infection. IgG can cross placenta, as well as the infection can also get into the fetus. Can also get into the not fetus, baby. During labor, this transmission actually occurs. That's why cord clamping and all has been introduced, it reduces the probability of transmission of HIV. Okay, so now the perinatal transmission rate can be reduced by at least 50% in single dose of nevirapine given to the mother. If when she will be pregnant, nevirapine will be given. When pregnancy will come to HIV mothers, pregnancy in HIV positive mothers, which drug? Nevirapine. At that time only nevirapine has to be given. It reduces 50% chance of the baby to get HIV from mother. And when the baby will be born, HIV mother is HIV positive, baby will be born. Again, nevirapine will be given to the baby within 72 hours. Within 72 hours. And breastfeeding is indicated in baby born to HIV positive patient. Breastfeeding is indicated. Okay, so these are the very important information given. Must be remembered each and everything, because this type of clinical based questions comes, even if it is not case study like this. The question one of the following methods are used for diagnosis of HIV. This diagnosis method, this all this can come either from infectious disease or from microbiology. So information, as for the information, was very important. Okay. Next question. Pulmonal test is used for the diagnosis of chickenpox, yellow fever, genital herpes, infectious mononucleosis. And the answer is infectious mononucleosis. It is diagnosed by pulmonal test. Revision of, first of all, EBV or Epstein-Barr virus is the causative of infectious mononucleosis. It is called glandular fever. Infectious mononucleosis is called a glandular fever. Clinical features include fever, lymphadenopathy, sore throat, presence of abnormal lymphocytes in blood. All these are infectious mononucleosis clinical features. Monospot test is also used for the diagnosis of infectious mononucleosis. Monospot test is used for the diagnosis of infectious mononucleosis, and patient develops skin rash if they consume an antibiotic like ampicillin. EBV is also oncogenic in nature because it causes B cell clonal activation. B cell clonal activation, and already you see EBV causes lymphadenopathy. So there are cancers of lymph glands or lymph nodes. Okay, so B cell clonal activation may cause this oncogenic consequences. Okay, so it must be remembered. And the antibiotic given is ampicillin. In this case, in infectious mononucleosis, we give ampicillin only, but ampicillin may cause again skin rash. Okay, next question. Gram-negative anaerobic bacteria use this method of gene transfer. By which method of gene transfer? Gram-negative anaerobic bacteria which type of gene transfer is used by gram-negative anaerobic bacteria? So transduction, conjugation, translation, transformation. Answer is conjugation. Some bacteria also transfer genetic material between cells by transduction. Transfer of genetic material from one bacterium to another by bacteriophage is called transduction. The most widespread mechanism of gene transfer among prokaryotes. Number one. Number two, transformation. Transfer of genetic material through the agency of free DNA. Free DNA uses this method of transformation to exchange genetic material. Number three is conjugation. Conjugation, DNA is transferred through direct cell contact. Gram-negative bacteria or gram-negative anaerobes uses this method, uses this process. That is E. coli, bacteroids, Porphyromonas, Fusobacterium use this method of gene transfer. Next question, during the lag phase of bacterial growth curve, there is increase in number, increase in metabolic rate, increase in size, decrease metabolic rate. Very, very important question. And the topic bacterial growth curve is one of the most important in microbiology. So there is increase in number, increase in metabolic rate, increase in size, and decrease metabolic rate. So the answer is increase in size. Now we will revise the bacterial growth curve. First of all, the growth cycle of the bacteria, or the growth phase of the bacteria. So these are divided, classified into how many phase? First of all, lag phase. Number 2, log phase. Number 3, stationary phase. And number 4, decline, or phase of decline. So first of all, lag phase. Number 1, no appreciable increase in number of bacterial cells occur. No significant increase in number of cells. But there is increase in size of the cell. So in lag phase, basically, there will be increase in size of the cell. No number. Accumulation of enzyme occurs, metabolic intermediates occurs. Accumulation of enzyme, that means enzyme will increase. Any metabolic intermediates occurs. Maximum cell size is obtained at the end of lag phase, because size increases and increases, lag phase is going on, size is increasing, and at the end of the lag phase, the maximum size will be seen, will be present. Number 2, log phase. It is called exponential phase. Logarithm, log. Exponential phase. Because exponential increase of cells, increase of number of cells occurs. That's why exponential phase, number of cells increases. Exponentially, there will be increase of number of cells, and cells are small and stained uniformly. And also metabolic rate increases. Metabolic rate increases. In stationary phase, viable count of cells remains stationary as an equilibrium exists between dying cells and newly formed cells. Stationary phase is basically what happens in this phase. Number of cells remains stationary. Same number of cells. Why? Because if X number of cells dies, then X number of cells comes up. That's why almost the number of cells will be similar, will be same, will be equal. And as an equilibrium is reached, we call it the equilibrium is reached between the dying cells and newly formed cells. Cells are viable, show irregular staining. In which phase regular staining is can be found? In log phase. In the log phase, staining is uniform. When staining is not uniform, irregular, stationary phase. Why it is non-uniform? Because due to intracellular storage granule. Sporulation occurs, sporulation, small spores. Sporulation occurs at this stage, must be remembered. Very important because the question comes sporulation, anything related to this bacterial growth curve can come in the question. Like the question here, it gave very simple question. During the lag phase of bacterial growth curve, there is which event? Increase in size. Lag phase, as we know, increase in size. So anything can come. Like the equilibrium is reached between dying and newly formed cells in which phase? Or metabolic rate increases in which phase? Staining is uniform in which phase? Staining is not uniform is which phase? Very important is sporulation occurs at which stage? At stationary stage, sporulation occurs. Production of antibodies and exotoxins also occurs in stationary phase. Production of antibodies and exotoxins, very important. Phase of decline. In phase of decline, there will be population of cells decreases due to cell death. Involution forms are common in this phase of decline. 4. This number 3, number 4. And population of cells decrease due to cell death. Very simple. You can understand by the name only, phase of decline. And involution of forms are common in phase of decline. Okay, next question. So very important, this bacterial growth curve is very important. You must remember, even this image is very important. IBQ, for IBQ it can come. Okay, in IBQ they can give this, and they can ask some questions based on this. They can point out and can ask. Like you can see the lag phase, there will be no number of cells increase. Bacterial mass. Okay, bacterial mass. Okay, so another graph is there. This is bacterial growth curve. Another graph is like this. Okay. So in log phase, they can ask some questions. They will just simply mark the question, mark this phase as X. Now this phase is declining growth. Declining growth, decline phase. So what involution are come in which is common at this phase marked by X? Sporulation, production of antibodies, staining uniform, or accumulation of enzyme, or involution. So answer will be involution because this is decline phase. So in this way question can come. They can mark the log phase, and you need to understand they will not say log phase, it will not be written. They will just point out point one like this, A or B or C, and they will ask what happens in A, or some other questions like this only. Okay, so this is log phase. What happens? Metabolic rate increases, number of cells increases exponentially, but size remains same. Size remains same. So different questions can come. So they will just frame the question in any way. You need to know whole of the phases of bacterial growth curve, whatever events are included. Okay. So that's what you need to know for FMG. Okay, next question. Tumbling motility is seen in Yersinia, Listeria, Proteus, and Pseudomonas aeruginosa. And the answer is Listeria. So Listeria is the bacteria that is classically associated with tumbling motility. Listeria, tumbling motility. Okay, Proteus, swarming motility. Pseudomonas aeruginosa, gliding motility. And Yersinia, is not given. So anyway, Yersinia may not show motility as well. Okay, so just they have given an option. So anyway, other more options, other motility has to be seen, like Proteus, swarming motility, gliding motility, P. aeruginosa, mycoplasma, darting motility, Campylobacter vibrio cholerae, Giardia, falling leaf motility, Vibrio, shooting star motility, T. pallidum, corkscrew motility, Borrelia, lashing motility. These motility comes under the microscope. Like if, for example, falling leaf Giardia, it will go like this. Like it is falling, the leaves fall the same way, right? Like this. In this motion, it goes under. We can observe under the microscope. Okay, next is T. pallidum. T. pallidum will like this. Will go like this, like corkscrew motility. So these motilities must be remembered. The name of the motility and along with the corresponding organism has to be remembered. Okay, next question. Which of the following is a kidney-shaped bacteria? Campylobacter jejuni, Corynebacterium diphtheria, C. diphtheria, meningococci, gonococci. So which of the following is a kidney-shaped bacteria? Kidney-shaped bacteria, gonococci. Some of the shapes of bacteria. Club-shaped Corynebacteria. Gonococci, kidney-shaped. Half molar lens, meningococci. Lanceolate, pneumococci. Coma-shaped is Vibrio cholerae, very common. Right, like this. And Campylobacter as well. So must be remembered these shapes. Some of these common shapes that is asked in FMGE. Next question. Granuloma in lymph nodes is seen in all of the infections except TB, sarcoidosis, Staphylococcus aureus, and Haemophilus ducreyi. So granuloma in lymph nodes seen in all the infections except Staphylococcus aureus. In Staphylococcus aureus, granuloma in lymph node is not seen. In diseases characterized by granulomas. Granulomas is not found in Staphylococcus aureus. In Staphylococcus aureus, there will be infections like pyoderma, abscess, HAP, food poisoning, etc. And it doesn't involve any lymph node. But these granulomas are present in tubercular granuloma. You have heard Heard about it. Granulomas of tuberculosis tend to contain necrosis. That is, caseating necrosis occurs, right? Caseating type of necrosis, caseating tubercles, but non-necrotizing granulomas are also present. Number one, tuberculosis. Tuberculosis. Next is leprosy. Leprosy, number two, leprosy. Granulomas are found in the skin and tend to involve nerves. Number three, sarcoidosis. This is a disease of unknown cause. Unknown cause. Sarcoidosis is a disease of unknown cause characterized by non-necrotizing or non-caseating granulomas in multiple organ and body sites, most commonly the lung and lymph node within the chest cavity. Most commonly the lung and lymph node within the chest cavity. Next is Haemophilus ducreyi. Causes Sankar. Haemophilus ducreyi causes Sankar, which is present with, basically what is Sankar? It's a lesion characterized by painful genital ulcer with painful lymphadenopathy. So here also we can get granulomas. So all these can be, sarcoidosis shows also granulomas. Haemophilus ducreyi can cause granulomas and also lymphadenopathy. Only Staphylococcus aureus will show infections, but granuloma will not be seen. Granuloma will not be seen in Staphylococcus aureus. Okay. Next question. Which of the following organism causes fastest food poisoning? Fastest food poisoning. Staphylococcus aureus. Very important question. This food poisoning. Staphylococcus aureus, Clostridium perfringens, Bacillus cereus, and Vibrio cholerae. The answer is Staphylococcus aureus. Now, bacterial food poisoning, very important topic for FMG. Another one of the most important topic. One is bacterial growth curve. Another is this food poisoning. Quite often asked from microbiology. First of all, if we need to study about food poisoning, then we first do classification based on the duration or onset. Okay, after having the food, 1 to 6 hours. 6 hours. Number 2, 8 to 16 hours. Number 3, more than 16 hours. Now, if food poisoning occurs within 1 to 6 hours, right after having the food, that means it should be Staphylococcus aureus and Bacillus cereus. And the symptoms will be nausea, vomiting, diarrhea, both the cases. In Bacillus cereus mostly occurs from fried rice, while Staphylococcus aureus from poultry, potato, salad, mayonnaise, cream, pastries, Staphylococcus aureus. Acute food poisoning occurs in Staphylococcus aureus within 6 hours. Very, very important. If the food poisoning occurs between 8 to 16 hours of after meal, then the organism can be Clostridium perfringens, Bacillus cereus again. So Bacillus cereus can cause food poisoning between 1 to 6, and as well as from 8 to 16 as well. So for the first 16 hours, Bacillus cereus can cause food poisoning. Now in Clostridium perfringens, what will happen? What are the symptoms? Abdominal cramps, diarrhea, vomiting rare. Very, very important. This point is very important. Vomiting rare. Rare vomiting. In perfringens infection. Also, B cereus, if it occurs between 8 to 16, then B cereus. Then also vomiting rare. But in case of acute food poisoning, there will be vomiting, nausea and diarrhea. But you see, one thing is very important. Nausea is there, diarrhea is there, vomiting is there. Both for Bacillus and Staphylococcus, B cereus and Staphylococcus aureus, when the food poisoning is occurring between 1 to 6 hours, but there is no abdominal cramp. Abdominal cramp starts after 8 hours. Then it is obviously not Staphylococcus aureus, maybe cereus, maybe Clostridium perfringens. So these symptoms are very important. Case studies can come. Now more than 16. First thing is watery diarrhea. If it is more than 16, you need to know some classification again. Watery diarrhea can occur. Number 2, bloody diarrhea can occur. Number 3, inflammatory diarrhea can occur. Number 4, dysentery. So watery diarrhea means Vibrio cholerae or ETEC. We'll study about this also. Enterotoxigenic Escherichia coli. E. coli. Enterotoxigenic E. coli. It occurs from salads, cheese, meats, water. And Vibrio cholerae from shellfish. Watery diarrhea. Next is bloody diarrhea. Diarrhea with some pinch of bloods. Enterohemorrhagic E. coli. EHEC. This is ETEC. EHEC. Enterohemorrhagic E. coli. Bloody diarrhea occurs from ground beef, roast beef, salami, raw milk, raw vegetables, apple juice. So if you can remember this, very good. If you can't remember this, okay, fine, no problem. But if you remember this, it will be added advantage, because in the case study, what will happen? They will give the concerned person has consumed raw milk or raw vegetables or raw or apple juice like this. So if you can remember this, it will give you an aid for the diagnosis to make. Okay, next is inflammatory diarrhea. Salmonella species from beef, poultry, eggs, dairy products. Inflammatory diarrhea can also occur from Campylobacter jejuni, again from poultry and raw milk. And dysentery, if there is dysentery, then two species. One is Shigella, another is Vibrio, not cholerae, Vibrio parahemolyticus. Vibrio parahemolyticus and Shigella. This is about dysentery. So very much important, this bacterial food poisoning, this table is very important, and from microbiology, one of the most important portion of topic. Okay. Okay, next question. A person consumes some milk products in a party and after 6 hours started vomiting. Okay. Which organism is most likely the cause? So either it will be Staphylococcus, or we know it can be Bacillus cereus also. So anyway, another thing is that some milk products. So if you see, first of all, 6 hours with vomiting. 6 hours with vomiting means either Staphylococcus aureus, Bacillus cereus, and Bacillus cereus is not in the option. But you see, so this or this. Now now this is the problem. A person ate some milk products. Bacillus cereus only fried rice. If it is 1 to 6 hours. If 1 to 6 hours, then fried rice. Say fried rice if it is 1 to 6 hours. But if it is more than 8 to 16 hours, then meats, vegetables, dried beans, cereals. Okay, so as it is 1 to 6 hours, no need to think about the below one. Think about this, and obviously not fried rice, not fried rice. So only milk products. Milk products like mayonnaise, cream, pastries can be consumed. So Staphylococcus aureus would be the answer. B series is also given in the option. So you must remember this also sometimes. Okay. Okay, so Staphylococcus. Staphylococcus causes food poisoning by enterotoxin A due to intake of milk and milk products. Very important, it's a preformed toxin. Preformed, heat stable enterotoxin. And it stimulates vagus nerve, causing vomiting as the main and first symptom. Very important. Vomiting. Incubation period IP 6 hours, within 1 to 6. Outbreaks following picnics where potato salad, mayonnaise, cream pastries have been served are the classical examples of staphylococcal food poisoning. Bacillus cereus is an important cause of food poisoning. Bacillus cereus is an important cause of food poisoning isolated from soil, vegetables, milk cereals, meat. Bacillus cereus is an important cause of food poisoning isolated from soil, vegetables, milk cereals, and meat. Okay, this is about Bacillus cereus. Now, Staphylococcus, it produces two types of food poisoning. One is Clostridium perfringens causes gastroenteritis after intake of infected meat or meat products, or Clostridium botulism causes food poisoning due to consumption of canned food, IP 1 to 3 days. Clostridium perfringens. So Clostridium perfringens can cause food poisoning, and it causes gastroenteritis after the intake of infected meat and meat products, IP 8 to 16 hours. This about this. And from botulism, Clostridium botulism can cause food poisoning due to consumption of canned food. Very important. So you must remember these things, that canned food poisoning from canned food is C botulism first of all, and IP is 1 to 3 days. Otherwise, it will be difficult for you to diagnose which organism is this. Okay. Okay. Now diarrhea type, main type is diarrhea. You see, if you see the whole chart, you can see either the diarrhea type or the vomiting type. You see here vomiting is there in the 1 to 6, vomiting, but no diarrhea. Also diarrhea is there, but vomiting is the first and most common clinical feature of this food poisoning. While others are diarrhea type. So we can also classify this food poisoning according to the main symptom. That can be diarrhea or emetic, vomiting type. So in diarrhea type associated with wide range of food intake, including meat, puddings, etc. Diarrhea type is IPs 8 to 16. This 8 to 16. Or maybe more than 16 as well. Occurs due to heat labile enterotoxin. As this is microbiology, you need to remember this, why it occurs. And for emetic type, associated with intake of Chinese fried rice, IP is 1 to 5 hours due to preformed heat stable toxin. Heat stable toxin. Okay, and IP incubation period is 1 to 5 hours. This is emetic type. So this is about again food poisoning. Food poisoning, you have to revise all these facts. Very important for FMG. Okay. Okay. Next question. Incubation period of Salmonella is 7 to 21 days, 2 to 5 days, 14 to 21 days, and 0 to 60 days. And the answer is 7 to 21 days. Basically, it is 3 to 21. So as this option is not there, 3 to 21, we have to choose 7 to 21 days. And Salmonella causes typhoid, as you know. It causes, what are the features of typhoid? The step ladder pyrexia occurs. Step ladder pyrexia. That means it will stay for a few days, again it will rise. Again it will stay for a few days, again it will rise. In this pattern, this is the pattern of the fever. Pattern of the fever. Then very important, rose spot. Rose spot of Salmonella. Like in measles, Koplik spot. Here in Salmonella typhoid, rose spot. Relative bradycardia, hepatosplenomegaly, epistaxis. Complication, intestinal perforation, GI hemorrhage, most common complication. Intestinal perforation, GI hemorrhage, seen during 3rd and 4th week. These are the complications. Okay, complication of typhoid. Okay, which of the following is most likely cause of child presenting with fever and diarrhea? Which of the following is most likely cause of a child presenting with fever and diarrhea? EPEC, ETEC, EHEC, EIEC. And the answer is EPEC. Now, enteropathogenic E. coli, EPEC. It causes diarrhea in infants and children, usually occurring as outbreaks, institutional outbreaks. In infantile enteritis, it does not produce enterotoxin, nor they are invasive. The bacilli that are seen to be, now this topic is another important. One is bacterial curve. Then we got this food poisoning, bacterial food poisoning, and bacterial food poisoning, and also this diarrhea type and emetic type, all this staphylococcus food poisoning, and all the food poisoning and their symptoms and sources. And another important is this portion, E. coli, and its classification, different classification of E. coli. This is another important portion from microbiology. In infantile enteritis, it does not produce enterotoxin. They are not invasive also. The bacilli are seen to be adherent to the mucosa of the upper small intestine and cause disruption of the brush border microvilli. These bacilli are seen to be adherent to the mucosa of the upper small intestine and disruption of brush border microvilli. Now, these stains can be identified by their addition to HIP2 cells. These strains can be identified by their addition to HIP2 cells. So, these bacterial strains, ETEC, can be they remain adhere to HIP2 cells, and in this way we can identify them. Other group of EC means E. coli are not do not remain adhered to HIP2 cells. Okay, so this is number 1. Number 2, enterotoxigenic E. coli, ETEC. It causes traveler's diarrhea. Very important. Traveler's diarrhea is caused by ETEC, enterotoxigenic E. coli. Is the most common cause of traveler's diarrhea. It produces enterotoxin, produce heat labile toxin or heat stable toxin, or both. Toxin production alone may not lead to illness, and the strain should first be able to adhere to intestinal mucosa. So toxin production alone may not lead to illness. The strain should first be able to adhere to intestinal mucosa. Then it will produce illness, right? The adhesiveness is mediated by fimbria, not medicated, mediated by fimbrial or fimbria or colonization factor antigen. How it get adhered to intestinal mucosa? Either by fimbria, it get hooked up, or by CFA, colonization factor antigen. Next is EIEC or enteroinvasive E. coli. They themselves resemble Shigella, and their infection resembles Shigellosis. These strains are non-motile, do not ferment lactose, lactose non-fermenters, not fermenters, or ferment it late with acid without producing any gas. If it ferments, it will be late, at later stage. It may ferment, but there will be no production of gas. Mild diarrhea occurs in this EIEC. Mild diarrhea to frank dysentery, and occur in adult as well as in children. Both adult and children, mild diarrhea to frank dysentery. Frank dysentery. They have been termed enteroinvasive. Why? Because they have the capacity to invade intestinal epithelial cells in vivo and penetrate HeLa or HEP2 cells in tissue cultures. They penetrate Hep2 cells in tissue cultures. This ability of penetration is plasmid determined, and it codes for outer membrane antigen called virulence marker antigen. So VMA is associated with virulence marker antigen is associated with enteroinvasive E. coli. The detections of plasmid can be diagnostic. Detection of plasmid. For laboratory diagnosis of EIEC, the Sereni test is used to be employed. Sereni test. Number 4. Enterohemorrhagic E. coli. These strains produce verocytotoxin or Shiga-like toxin. These strains produce VT or SLT. They can cause mild diarrhea to fatal hemorrhagic colitis. So mild diarrhea to frank dysentery, EIEC. And EHEC or enterohemorrhagic E. coli, mild diarrhea to fatal hemorrhagic colitis. Very important. This toxin acts on vascular endothelium, promoting synthesis of coagulation factor. 8th coagulation factor. And von Willebrand factor causing platelet aggregation. So EHEC cause platelet aggregation. Remember. Why? How? Because the toxin produced by EHEC, enterohemorrhagic E. coli, is this toxin, VT or SLT, verocytotoxin or Shiga-like toxin, and this toxin, it acts on endothelium. It acts on endothelium vessels epithelium, endothelium, and subsequently what will happen? It will promote the synthesis of coagulation factors 8 and von Willebrand factor, and they will cause platelet aggregation. And in this way, we can say EHEC infection will lead to platelet aggregation. They can cause hemolytic uremic syndrome. Hemolytic uremic syndrome, particularly in young children and elderly. Hemolytic uremic syndrome. Most prominent serotype of EHEC is 015787. Is 287. This is the most prominent, not 0 actually, 015787. This is this strain. Most prominent serotype of EHEC associated with hemolytic uremic syndrome, HUS. The primary target for this VT means verocytotoxin, is vascular endothelium, as we have already discussed here. Lab diagnosis of VTEC or EHEC, same. VTEC means verotoxigenic E. coli or enterohemorrhagic E. coli. So lab diagnosis of VTEC diarrhea is established by demonstration of the bacilli or verocytotoxin in feces directly or in culture. Demonstration of bacilli can be done. VT can be demonstrated in feces directly or in culture. This is about EHEC. Next is EAEC, enteroaggregative E. coli. They have been associated with persistent diarrhea, number 1, especially in developing countries. In vitro, they appear aggregated in stacked brick formation of HEP2 formation in HEP2 cells. So this is the most important, one of the most important portion of microbiology for FMG. Okay, you must go through each one of these features is very, very important. Outbreaks, enteropathogenic. We haven't studied about outbreaks in other strains. For other strains, we haven't studied about outbreaks. Outbreaks is enteropathogenic. Infantile enteritis is caused by EPEC, enteropathogenic E. coli. Traveler's diarrhea, enterotoxigenic, ETEC. Most common cause, traveler's diarrhea. Then invasive, enteroinvasive EIEC, mild diarrhea to frank dysentery. Sereny test is done in EIEC. Sereny test. Hemolytic uremic syndrome occurs in EHEC, enterohemorrhagic E. coli. Enterohemorrhagic E. coli. Hemolytic uremic syndrome, HUS. And their primary target is vascular endothelium causing platelet aggregation. So platelet aggregation occurs in EHEC. EAEC, enteroaggregative E. coli. Enteroaggregative E. coli associated with persistent diarrhea. Persistent diarrhea is seen in. Persistent diarrhea is seen in. Persistent diarrhea is seen in EAEC, enteroaggregative E. coli. They appear aggregated in stacked brick formation in HEP2 cells. Next question. Antimicrobials are given with which type of diarrhea? Travelers, rotavirus, travelers diarrhea, rotavirus diarrhea, secretory diarrhea, osmotic diarrhea. And the answer is travelers diarrhea. Antimicrobials are given for travelers diarrhea. Standard regimen is a 3-day course of quinolone taken twice daily. So what is the regimen for travelers diarrhea? Quinolone taken twice daily, 2 times daily, BD for 3 days. Okay, BD for 3 days. So the current approach to self-treatment of traveler's diarrhea for typical short-term traveler is to carry 3 once daily doses. Carry 3 doses of OD regimen. And to use as many as doses necessary to resolve the illness. If neither high fever nor blood in the stool accompanies the diarrhea, then loperamide can be given with combination with antibiotic. Studies have shown that this combination is more effective than antibiotic alone and does not prolong the illness. So if there is no fever, if there is no blood in the stool, no fever, no blood, then quinolone means antibiotic. Antibiotic plus loperamide. Loperamide will constrict external anal sphincter. Okay. Prophylactically, we can go for bismuth subsalicylate. And for certain individuals like athletes, persons with repeated history of traveler's diarrhea, persons with chronic diseases, a single dose of quinolone or azithromycin or rifaximin can be given during travel, but less than 1 month's duration it should be. It is also efficacious in prevention of traveler's diarrhea. Causes of traveler's diarrhea is ETEC, right? ETEC is most common cause of traveler's diarrhea. Another causes are EIEC, Salmonella, Shigella, Vibrio cholerae, Vibrio and Campylobacter. All these can also be the causes of traveler's diarrhea. Very important topic, traveler's diarrhea. Which is the next question? Which is the staphylococcal toxin that is responsible for food poisoning? And the answer will be enterotoxin. Enterotoxins are responsible for food poisoning. Many times while studying the food poisoning, we have studied about enterotoxin. And they are produced from Staphylococcus aureus, which grows in carbohydrate and protein foods. There are multiple types of enterotoxin: A, B, C, D, E, F, G, A, B, C, D, A, B, C, D, E. Then not F, then G, H, I, then KLM, and these are usually super antigens. Alpha toxin is a potent hemolysin. Alpha toxin is potent hemolysin, which acts on broad spectrum of cell membranes, including the RBC cell membranes. The alpha toxin. A means alpha. So alpha toxin can act on broad spectrums, broad range of cell membranes, many cells. Cells of many cell membranes of many cell types, including the RBC also. The beta toxin degrades sphingomyelin and is also toxic for many types of cells. Okay, TSST1 is the same as enterotoxin F and is therefore for superantigen and associated with fever, shock, multisystem involvement, and desquamative skin rash. TSST1. It's kind of enterotoxin F. Okay, so this is about enterotoxin. Enterotoxin basically it causes food poisoning and are produced when Staphylococcus aureus grows in carbohydrate and protein food that is consumed by us. Okay, next question. All of the following organisms cause gas gangrene as gangrene only. So all of them cause gas gangrene as gangrene except which organism? So the answer will be difficile. Clostridium difficile. Gas gangrene is myonecrosis caused by muscle necrosis caused by bacterial infections, further lead to toxemia, shock. So it can cause myonecrosis, that is gas gangrene, lead to toxemia, and shock. Notice by black shores, clinical manifestations. Clinical features we see black sores, right? Only blackened skin, black sores. And crepitus caused by gas. Nitrogen is the predominant gas component, followed by oxygen and crepitus. Clostridium microbes which cause gas gangrene are Perfringens orwellii, septicum, or novi. Difficile cause acute enterocolitis. In a diabetic patient, the more likely pathogen of gas gangrene is Klebsiella. For diabetic people, pathogen of gas gangrene is Klebsiella. Pneumonia. Remember this for diabetic people. Otherwise, it is Clostridium difficile. Sorry, no. Difficile is except, sorry. These three causes myonecrosis, toxemia, and shock. That is Perfringens or Welchii, septicum, novi. And difficile doesn't cause. Difficile causes acute enterocolitis. Completely different. acute enterocolitis. Sorry, these three causes myonecrosis. This Clostridium welchii, septicum perfringens causes myonecrosis, or we can say gas gangrene. Gas gangrene. Okay, Clostridium welchii, septicum, and perfringens causes myonecrosis or gas gangrenes, leading to toxemia, leading to shock. And Clostridium difficile causes acute enterocolitis. Acute enterocolitis. And gas gangrenes appears as black shores and crepitus. Okay, so this is about gas gangrene. And another thing is very important. This question also comes in diabetic patients. The pathogen of gas gangrene will be Klebsiella pneumonia. Klebsiella pneumonia. Clostridium microbe that causes tetanus is tetani. That's why it is named as such. Clostridium microbe that causes food poisoning is Perfringens type A gastroenteritis, Perfringens type C necrotizing enteritis, and Botulinum botulism difficile acute colitis or enterocolitis, as we have studied here, like acute enterocolitis. Okay, difficile. Fournier's gangrene is caused by Welchii, Clostridium welchii, Proteus, Streptococcus, E. coli. Fournier's gangrene is caused by E. coli. What is Fournier's gangrene? It is defined as polymicrobial necrotizing fasciitis. Polymicrobial necrotizing fasciitis of perineal, perianal, and genital area. Basically, fasciitis, fascia, inflammation of the fascia, skin fascia, inflammation of the fascia. So fasciitis. Basically fasciitis in which region? Fasciitis in which region? Perineal, perianal, and genital. This is fasciitis, and it is necrotizing type. In the majority of the cases, Fournier's gangrene is a mixed infection caused by both aerobic and anaerobic bacteria. These are some of the other organisms which causes Fournier's. So wound culture, causal agents. See, wound culture from patients with Fournier's gangrene reveal that it's a polymicrobial infection with average of 4 isolates per case. E. coli is the predominant Aedes E. coli. That's why we have chosen E. coli as the correct option. And bacteroides is the predominant anaerobes that causes Fournier's gangrene. So Fournier's gangrene is caused by many other microflora. Another thing is that it's a polymicrobial, not caused by single organism. It is caused most commonly. It is caused by many organisms, predominantly by E. coli. Predominant aerobes is E. coli. Another predominant anaerobes is bacteroids. Okay. Next question. Anchovy sauce pus or chocolate brown pus is a clinical feature of amoebic liver abscess, pyogenic liver abscess, peritoneal abscess, hydatid liver. The answer is amoebic liver abscess. It is a liver abscess caused by Entamoeba histolytica. So this type of pus is found in amoebic liver abscess, common in tropical countries, exist in vegetative form outside the body and is spread by fecal-oral route. Caused by fecal-oral route. Presents with pain in the right hypochondrium, number 1. Number 2, fever. Number 3, profuse sweating. Number 4, rigors. Number 5, loss of weight. Diagnosis of choice is USG and dose is metronidazole. Okay. Most common pneumococcal. Most common cause of pneumococcal is Streptococcus pneumoniae. Haemophilus influenzae, Serratia marcinens, and Staphylococcus aureus. And the answer is Staphylococcus aureus. Pulmonary pneumatocysts are thin. What is pneumatocyst? They are thin-walled air-filled cysts. Pneumatocysts are thin-walled air-filled cysts developed within the lung parenchyma. Very important point. Lung parenchyma present within the lung parenchyma. They can be single emphysematous lesions, but are also more commonly multiple thin-walled air-filled and cyst-like cavities. Pneumatocysts are generally observed soon after the development of pneumonia and can be observed on the initial chest radiographs. They are commonly caused by Staph aureus. Other causes of pneumatocysts includes Streptococcus pneumonia, H. influenza, E. coli, group Streptococci, Serratia marcinens, Klebsiella pneumoniae, adenovirus, and tuberculosis. But most common is Streptococcus aureus. Most common is Streptococcus aureus. Most common is Staph aureus. This Serratia marcinens also causes pneumatocyst. Haemophilus influenza also causes pneumatocyst. Streptococcus pneumonia also causes pneumatocyst, but the question was most common cause, that is Staphylococcus aureus. Non-infectious etiologies include hydrocarbon ingestion, trauma, and positive pressure ventilation. Hydrocarbon ingestion can cause pneumatocyst. If there is trauma, it can cause pneumatocyst, and PPV or positive pressure ventilation can cause pneumatocyst. Okay, next question. This is the last question. Child presented with cystic fibrosis and pus seen. So cystic fibrosis and pus. Which group of organisms appropriate causative agent? So pus is seen. Pus is seen means Staph aureus. Most common cause of pulmonary infection in cystic fibrosis. If it is children, then Staphylococcus aureus. And another thing is pus is seen most commonly in Staph aureus infection. Yes, adolescent and adults, and overall Pseudomonas aeruginosa. Staph aureus, Pseudomonas are the main cause. Pseudomonas you also need to, although it is child, in child generally Pseudomonas do not infect for pulmonary infection, but you should go for this group 1, this option, not the option C, because Pseudomonas is not present here. Pseudomonas, Staph aureus, both are present. Although Staph aureus is the most common cause for the children. Okay. Okay. Thank you for this microbiology.
The next class will be tomorrow?
On Friday.
On Friday. Okay.
On Friday will be the next class, and I have given you the PPTs, the previous ones.
Yeah, sure.
Yeah. Okay. And on Friday again we will start with a new subject, and not many subjects are left. We will finish, and one day there will be case study and all subject also. Okay. And other materials.
And do you discuss even image-based questions or?
IBQ, yeah, IBQ. One day there will be case study along with IBQs.
Okay.
Okay. Only all subject IBQ and case studies will be there.
Okay.
Okay. Okay.
Thank you.
Okay. Bye.